It is time for our monthly Vision Talk program. Joining me in the studio, as I've mentioned a couple times already this week, we have Dr. Jake Smith, of course, who is, one of the best here on the island. And we're glad he's joining us today. Yeah, people can argue if they want, but it doesn't make any sense whatsoever. So good you have you here from the Eye Health Clinic again, Dr. Jake. There was a time when our listeners heard from you regularly, and now the business just keeps you so busy. Yes. You hardly ever get time to come up here. He literally said he's been doing cataracts today, and that's what we're here to talk about. The man is booked up, I think, well into halfway through 2026, but we're really going to talk about, of course, the great treatments that are available, right, Theresa, to perhaps, make the best of vision issues, be they cataracts and glaucoma specifically today we're going to talk about. And, let's just jump right into it. I guess, Theresa, you want to do any introduction? You want to talk a little bit about getting through World Sight Day?
Oh, yes, please.
And how well that went?
Yes, before we hear from Jake, which I'm very excited about. Thank you so much for joining us.
Thank you for having me.
I would really like to say a heartfelt thank you to everybody that supported us last week at Vision Bermuda.
Good stuff.
For our World Sight Week.
Sure.
Really.
You guys had a good time with all the events?
We did. Lindo's. We had a lovely response from Lindo's in Warwick. Thank you so much for Tag Day. And sorry, am I allowed to say I was on another radio station?
You're allowed to say you were on any radio station you want, honey.
Which was really really interesting and a lot of fun. We also had our open house where I met some new people. I got some new clients, and that was really fantastic. And then we had Funky Frame Friday on Friday, so it was really busy.
Yep.
Erica kept us very busy. She's got a fantastic vision for our future. And there's a bit of a plug there, isn't it? Vision Bermuda, vision for the future. But she has. She's amazing, and everybody that she knows. So I want to thank all of our donors, our dedicated volunteers, everybody that helped raise awareness in that week. We were in the newspaper. Sure. We did a podcast. I mean, It was just incredible. And all the fantastic feedback we got with our social media, the brilliant reels we had, people wearing their funky frames. And
people can see those by checking out your social still, right? Yes. They can on your Facebook page and all.
And Instagram.
And Instagram. Nice.
Yes, please do. So I just want to say thank you to everybody that donated. Oh, we had our first raffle.
Yes.
Yes, I could just hear Erica shouting at me, raffle. In the mind, there's telepathy there.
And you had a really good response to that.
We sold out every single ticket.
Some happy winners.
Yes, and lots of happy winners. And everybody that donated, everybody that gave their time and encouragement and support to Vision Bermuda. Thank you so much. Got tongue-tied on the Bermuda there. Look.
Good stuff.
Thank you so much. We really appreciate it.
And I think it's doing a world of good. Having our professional in here today, because as you said, you met some new clients who perhaps would not have come to you if we hadn't had all this
raising awareness. Absolutely. That's how they found us. Is by raising awareness.
And also, there'll be the opportunities to help them with whatever those their vision issues are, because we have ophthalmologist Dr. Jake Smith here, providing high-quality eye care in Bermuda since 2018. Of course, we talk about the Eye Health Clinic, and Dr. Jake trained in London, of course, and has performed thousands of successful procedures. How many today, Dr. Jake? Just today?
Well, today I did 8 cataracts.
8 cataracts just today, folks, and he really needs to polish his nails on that one, because speaking for a family member who was very trepidatious about getting it done, but then another family member got it done, and the word of mouth is going to go around, Jake. Your phone line's just going to be blowing up with everyone that has been putting it off for a long time, and there are those who really struggle with should I and shouldn't I. But let's just talk a little bit about understanding the conditions. We are talking about cataracts and glaucoma today and what the difference is. Can someone have both at the same time? How common are they? All of that stuff?
Yeah, they're different conditions, but they've got some things in common. So cataracts happen to us all as
Sure.
we get older.
Unavoidable.
Unavoidable. I mean, that they happen to people at different ages, but typically somewhere between the mid-60s, and almost nobody gets much beyond their 80s, 80 without some significant cataract.
Sure.
So those are the sort of, and the average age that we do cataract, certainly here in the UK, is 72, 73.
Got you. In the 70s generally.
In the early 70s. Some people late 60s.
Yeah.
There are some things that can bring on cataract at a younger age.
I was just going to ask, is there any, sort of, out of the blue, okay, there's a young person in their 30s due to something can contribute to the cause of them?
There were some environmental factors and some genetic factors.
Injury too, perhaps?
Injury, if you get punched in the eye a lot, that's going to cause cataract. Inflammation inside the eye if you have uveitis.
Sure.
And then there are some things like smoking that give early cataracts, or if you have high blood sugar, if you have diabetes.
Metabolic disease contributes to it a lot.
Causes early
right?
cataract.
Mm-hmm.
Yeah. So all those things can contribute.
Mm-hmm.
In some ways, I think we can be much more relaxed about cataract than we can about glaucoma.
Sure.
The reason is that cataracts are reversible.
Sure.
So if you have a cataract, even if you've left it to get quite bad and your vision isn't good,
mm-hmm.
you can still have the surgery done and that vision can be restored.
Sure.
The same isn't true of
for glaucoma. And the vision loss that it causes as it progresses, right?
Right.
Gotcha.
So the vision that you've lost from glaucoma can never be returned, and that's the sad fact about glaucoma, and why glaucoma is something we need to screen for routinely. And one of the main reasons why, well, not the main reason, but one of the reasons why people are encouraged to go to their optometrist regularly
mm-hmm.
is to be screened for glaucoma.
Sure.
It's often called the silent thief of vision, because people don't notice that their visual field, their peripheral vision, isn't
of
what it used
closing
to be.
in and so on, and the causes that bring on glaucoma.
So often runs in families.
Sure, it can be genetic.
They're not always, but it does multifactorially. So a little bit like heart disease runs in families, not very strictly, but if your dad had a heart attack, that doesn't mean that you will, but it means that you're more
predisposed.
likely to.
Yes,
you're predisposed.
Gotcha.
And if cataracts get very big, they can contribute to glaucoma. So they have a relation, particularly if you're long-sighted. So if you get into your 40s and find that you need to wear glasses all the time, not just for near work, then you're somebody who's long-sighted.
Sure.
And if you're long-sighted, you probably have a small eye, and a big cataract in a small eye can lead to the pressurizing, squeezing of the drainage.
Glaucoma, just in layman's terms, is what going on in the eye, Jake, if you don't mind going over that.
Yeah.
Pressure, we know, but in regards to what?
So it's a limitation of the optic nerve, the nerve that carries the information that the eye produces to the brain. And when there's not enough nerve left to carry all the information the eye produces,
mm-hmm.
the peripheral vision starts to get lost first.
Gotcha. Mm-hmm.
And the thing progresses until ultimately the central vision goes and there's no vision at all.
Mm-hmm. Okay.
So it's important to catch it early, because whilst we can't return the vision that glaucoma has taken away,
we can arrest it a little bit, can we?
Okay. We ought to be able to arrest it. We almost always can.
Gotcha.
Yeah.
So you hear that, folks. Don't despair, I guess is what we're saying here too. It's well worth, and for folks, you definitely should be getting an annual with your GP. But I know there's a lot of GPs who count on the optometrist getting some stats with eye exams to help them inquire about other things, because you can see through the retina inside blood vessels.
Yes.
It's the only way you can do that, actually, without cutting the body open. So there you go. We want to encourage. And have you seen more of a sort of good relationship coming with GPs who say, go and see your optometrist, and then we'll make our annual appointment, and we'll have this info and that info and that info going forward?
I think there are a couple of sort of cut-offs in life.
Sure.
When you start to need to renew your driving license.
Sure, yeah, that's the big one.
We're
just talking about that.
It is. That's a cut-off that encourages lots of people to get checked out.
Yeah.
And it's not unusual that that's when cataract or glaucoma is uncovered.
Sure. Okay.
because
people might have been avoiding it all this time, but now when they can't get that license, they're like, let me go see Dr. Jake.
I think cataract surgery has been getting safer and safer.
Sure.
And I think we often think about the way cataract surgery was 10, 20, 30 years ago when our parents might have had it done, when we tended to leave cataracts a little bit later because the risks of cataract surgery were more significant.
Gotcha.
Cataract surgery's become a pretty routine procedure.
Sure.
Millions of cataracts are done each year just in the States.
Yeah, the research into the technology over the last 2 decades has made that difference, right? And you have specific procedures and instruments and things to use now.
Yeah, the machines that we use to remove cataracts have been incrementally getting better and better, and it's really about the machines making it safer.
Sure.
When I say they're better, it just makes it safer.
Safer, yeah, absolutely. The risk of other sight loss, you mean, was always an issue before?
Well, there are of course things that can go wrong during cataract
in any surgery.
In any surgery, but they quote the risks as less than 1 in 100 now of there being
an issue of any sort.
An issue of any real kind.
Gotcha. Yeah, that's really, really good to know. So you did mention, early signs and what people can think about: sensitivity to light, seeing the halos around the street lights when you're driving at night. These are things to look out for.
With Bermuda's narrow roads, the thing that most people notice first with their cataracts is night driving. The oncoming vehicles it becomes very difficult, and you find yourself having to stop when there are bright lights coming in the opposite direction. Mm-hmm. And people think it's due to the new lights, and then I say talk to younger people and see if they have the same problem.
Sure, exactly.
And mostly
then they're like, well,
they don't.
Okay, there you go. So yeah, that's usually the first sign. The light halos. When you're outside, but understanding that early detection will have the best results. We want to encourage folks out there to not waffle in these things, right?
There were a number of other advantages for having cataracts at a relatively early stage, particularly if you're someone who's got a significant glasses prescription.
Sure.
If you want to do something to get rid of glasses, generally if you're under 45 or 50, we think about laser eye surgery, about
LASIK surgery. Mm-hmm.
And generally if you're over that sort of age, then cataract surgery, lens exchange surgery is a
Sure.
better option.
Absolutely. And for folks like, I think about my dad who's worn glasses his whole life since I can remember.
Yeah.
And, he's got to get this done soon. And it's not going to take away his need to wear glasses by getting, or will it, his surgery, because he's always had bifocals where he's had to have the little magnifying thing below and all of that.
So cataract surgery can be used to reduce one's needs for spectacles. I'm not going to say completely get rid of it, because the flexibility of one's eye has gone by the time
when you're that older.
When you're that old, but you can be less dependent on
less
glasses.
Dependent on them.
And I think he'll be good most of the time without glasses.
Yeah, that's
and
something.
We'll certainly have that discussion when
you see him. It's going to be something I'm sure that he's looking forward to too. Because as a person who's relied on bifocals his whole life, and he's a skilled carpenter, it has become a real hindrance to have to either look up at things from underneath to try and fix them. And he's always on a project and stuff like that.
One thing about carpentry is the power tools.
Yes,
you probably need to wear glasses.
You would want to have them on, for power tools and all, but almost just for the logistics of certain situations where you have to work and wanting to get I think that's going to be just great for him, and he certainly is after hearing such good reports from others, looking forward to getting it done. And again, for the driving at night thing and everything too, looking forward to that. So you did talk about lens replacement with cataracts. Can you talk just a little bit more about that in layman's terms, and sort of what's the post-op and what do people have to do beforehand, that type of thing? Yeah.
So let's talk about the lenses first. So we use lenses in order to reduce the need for glasses. So if you're somebody who's worn glasses even for distance, then when you have cataract surgery, you can get rid of the need for glasses for distance.
Okay.
There are lenses that can allow you to be free of glasses completely.
Sure.
They all involve some level of compromise. So the lenses that give you distance, intermediate and near vision without glasses, they work simply by splitting the light. A third for distance,
Gotcha.
a third for intermediate and a third for near. In bright light, they work fantastic.
Sure.
And you can be genuinely free of glasses.
Sure.
In dim light, you're only getting a third of the light you would otherwise get.
Gotcha.
So you get some glare, some halos around bright lights, and a reduction in contrast sensitivity. By that I mean the ability to distinguish two shades of grey. So a very pale grey with a slightly darker grey can become harder to distinguish than it would if you had a 100% of the light going into the eye. But for the right people, who, though particularly those who find wearing reading glasses a nuisance and having reading glasses strewn all over the house and elsewhere,
Having to change glasses or whatever all the time. Yeah.
Those multifocal lenses can be really wonderful.
Yeah.
There's a halfway house which I think in the last few years has become more popular, which is what's called an extended depth of focus lens.
Okay.
Rather than splitting the light in distance, intermediate and near, it just splits the light into two, distance and intermediate.
Gotcha.
And actually most people with less spread out light find that they almost never need glasses.
Gotcha.
Just for extended reading. But they really don't need glasses most of the time. And they don't come with the same level of glare and halos that the true multifocal lenses come
Gotcha. Yeah. So there's a bit of a compromise there that seems to make it more comfortable for a lot of folks. Is that dependent on age too? Like older folks may want the second one as opposed to the three?
No, I think they can work for all ages.
Sure.
I would say anyone who has any reduction in their vision from another condition in their eyes, such as diabetes or macular degeneration or glaucoma,
Sure.
you have to be very wary about not using 100% of the light at the distance you're looking at. So
Gotcha.
in
Okay.
people with other conditions with their eyes, I would be much more circumspect about using one of the clever lenses that can
I see.
make you less dependent on spectacles.
About how long is the procedure in each eye, Dr. Smith?
Say for about 15-20 minutes.
It's that quick, folks.
Yeah.
It's that quick. So it's not like you got to be out for a whole day on a table somewhere.
And in terms
what
of
about recovery?
The recovery is really very quick. I think that's the take-home message. So it's walk-in, walk-out surgery,
Sure.
local anaesthetic, day case. So
Sure.
the anaesthetic is just drops. People get very nervous that there might be needles involved.
No needles in the eye, folks.
No
okay?
needles in the eye. Just drops to numb the eye. And a little bit of anaesthetic that we use during the surgery inside the eye. Afterwards, you'll have drops to take a couple of times a day for a month thereafter.
Okay.
And that's it. There's often a long list of do's and don'ts, but really what I say is you've got to take your drops, you shouldn't rub the eye, and that's about it.
Sure. Yeah, that's pretty simple. Now, glaucoma and treatments and management options for that?
Yeah. So the goal of treatment in glaucoma is to get the pressure in the eye
Sure.
down. And there's three ways we've got to do that. The traditional treatment has been drops. Drops work great. The problem with drops is once you start them, that's it. You're really not going to stop for the rest of your life. And whilst taking a drop every day seems like a relatively minor thing to do, if you're going to start somebody on drops for the rest of their life, that's
Quite daunting.
It's quite daunting. It's an undertaking. So we ought to think very carefully before we start somebody on drops for the rest of their life. The second treatment is laser.
Gotcha.
Laser has taken over now as first-line treatment.
Sure.
It's called selective laser trabeculoplasty. It's been shown in trials to be at least as effective as drops in the real world, probably more so because people forget to take their drops.
They forget, and
They
then
do.
of course their situation is advancing if they're forgetting, right?
Exactly. Yeah. So head to head, laser probably does beat drops. It lowers the pressure at least as much as drops. It lasts about a year and has to be repeated. The problem with that is it's a trip in to see the doctor and have a little laser procedure. But
How invasive is that, Dr. J?
not. I mean, you
Not at
have to sit at a little machine and hear a beep beep beep. But that's
That's
really
about it.
That's the extent of it. There's really not much to it. There's not a great deal that can go wrong with laser.
No
for
discomfort or
glaucoma.
anything.
Give you some drops to reduce any inflammation caused
Gotcha.
for 5 days afterwards. But I don't think it's a terribly invasive procedure, and I haven't really seen any significant complications.
Gotcha.
For it. Yeah. In fact, I'd go so far as to say, and the trials do substantiate this, that the side effects of laser are less than the side effects of drops.
Cool.
And most people don't think about the potential side effects of drops, but there are some.
But there are some, I'm sure. Yeah. You're talking about stuff being absorbed into your eye that goes to your brain. You know what I mean? All of that and a bag of chips. Yeah. So I guess what we're really trying to get the point out there that, you know, if you've been diagnosed with either of these issues, is sort of not to despair, that there is lots of help right here in Bermuda, and
nobody should lose vision permanently from glaucoma, because on the whole it does get picked up. The problem is that it's very easy to lose that train of treatment. Once somebody gets diagnosed, you then need to be followed up and make sure that the pressure, and it's a long-term, forever condition once it's been diagnosed. So lives get complicated. People move from one place to another, and they get busy, and treatment often gets...
Access to healthcare sometimes can be an issue.
Forgotten.
Yeah. But just, I think we're really lucky here that, I mean, just about anywhere there are help, financial assistance, whether that be payment plans, so on and so forth. If you're insured or underinsured, there are ways to get information on all of that. I guess the point we're trying to make is don't leave it, to chance. Don't go hide away and hope that it goes away, yeah?
I think people get worried that, on their insurance that vision is often quoted as...
Sometimes not included, separate.
All this stuff is considered medical.
Sure.
So it's not the vision...
It's
really,
not elective.
The vision really refers to optometry and glasses.
Sure.
But the treatment for glaucoma and cataracts is considered medical. It's not the vision add-on that you might have.
Gotcha. Okay.
That's interesting. I didn't know that.
That's probably good to know, because there are people out there saying, "Well, my insurance is not going to cover that," and it just might. Ask the questions, I guess, is this thing, and make sure that that you've got all the information you need, to get this sorted out. Because you coming in here and talking today, I'm hoping there's some listeners out there who are like, gosh, I've been putting this off, and I really shouldn't. There's no reason to, and there's no reason to worry about the treatments and having some heinous side effects or anything like that. Here we are trying to reassure folks that you can take care of your vision relatively comfortably right here in Bermuda without a whole lot of excess worry and things like that. And that's the point we're trying to get across here. We have touched on, life after diagnosis. Of course, you want to maintain your independence and confidence. Theresa loves all of her clients, but would rather we could arrest some vision loss here on the island, I'm sure, right, Theresa?
So cool.
Where rather we would prevent it rather than try to treat it afterwards. I'm sure Dr. Jake would say so. Let's talk a little bit about prevention and eye health tips, folks. We've still got 5 minutes or so left here, Jake.
I think the biggest one, particularly for glaucoma, is seeing an eye care professional of some kind.
Sure.
Regularly. Glaucoma particularly will be detected by any eye care professional, optometrist, ophthalmologist, whoever you see.
And it's a non-invasive test either. Is that the puff of pressure that you get?
Either the puff or a little machine that just checks the pressure. There's a number of different
ways that they
machines,
do it.
but it's not invasive.
Not at all.
It's
yeah.
really,
so we want to tell folks, you got to go get this done.
And cataract just involves somebody having a look. It really is that simple. The cataract, when you look in the mirror, you see there's the white of the eye on the outside. Then there's the coloured part, the iris that you see, and then right in the middle there's the pupil, the black bit, and the cataract is that lens, that black bit in the middle.
Sure.
That when you look at it with a bright light, you'll see that's
it's a little bit cloudy.
It's a little bit cloudy.
Yeah, exactly. For sure. Are there any myths about cataracts or glaucoma that you'd like to clear up? We've probably touched on them a bit here, as far as the, don't be scared of things because there's nothing to be afraid of. But is there anything else
Let's see if we can think of
we want to debunk
about one of those? I think that that glaucoma always leads to blindness, and
sure.
that shouldn't happen.
Sure.
I think if all good eye care professionals will make sure that if you're regularly followed up,
sure.
that you won't go blind from glaucoma. It really shouldn't happen.
Sure.
Cataracts are reversible, and I see lots of people whose vision is very poor from cataract, and I often wonder why.
Why do you wait so long?
Why do you wait so long?
Yeah.
But it's great because then when you do get it better, they're more thrilled.
And you are the miracle worker of all miracle workers, Jake. I'm sure there's like children named after you and stuff like that because of the great stuff that you've done. Even Theresa was, talking a little bit about being worried about cataract surgery, and that's
don't
yes.
give away my secret.
Well, we all think about, is it going to hurt or something? But here, Jake has just cleared all that up about how minimally invasive it is. So that's a myth that's been cleared up for you, Theresa, for sure.
It is, absolutely. And I just had another thought, and now I can't remember it. So just give me a moment.
Yeah.
There's a little thing here saying, is there a relation between cataract and glaucoma?
We did talk about having both too, Dr. Jake, and if that comes about, is there any difference in what you're doing for your patients?
If you're going to operate on an eye and spend, albeit 15 minutes inside somebody's eye, and they've got glaucoma as well as cataract, I feel like you might as well do what you can to treat the glaucoma at the same time.
Sure.
And there are a number of treatments that are minimally invasive, called MIGS, minimally invasive glaucoma surgeries.
Okay, MIGS, just like the
MIGS,
airplane.
that can be undertaken at the same time as cataract surgery.
Well, there you go.
And they don't add a great deal of time onto the cataract surgery, the invasiveness, and they can be similarly effective to taking drops for the rest of your life.
Gotcha. Yeah,
I remembered what I wanted to ask you. So I had a client ask me this. She has been recommended to have cataract surgery, and she's a little apprehensive, as would I be, I have to be honest, and now every listener knows that.
Sorry, Teresa.
It's okay. I'm only teasing. Is there a time frame to have them done? So if you go to ophthalmology, or I go to you and you say to me, okay, your cataracts,
you're going to need
the operation, is there a time frame from when they become ripe to overripe? I guess that's individual for the person, but can they ever become overripe and then you can't have the surgery?
There's nobody, I think, where I've said you cannot have the surgery. The risks of removing cataracts when the cataracts get really extreme do go up a little bit.
Gotcha.
Right.
But I don't think very few people are in that situation.
Okay.
I think the time to remove cataracts is when you can't do things because your vision isn't good enough. The one that I often ask about is driving at night.
Sure.
And it strikes me, life is short, and it strikes me as a shame to be going around with vision that's not as good as it
could be.
As it could be.
Yeah.
So, that comment that you said that somebody needs to have their cataracts done or is going to need to have their cataracts done, that applies to all of us. We're all going to have our cataracts done eventually.
Sure.
Nobody gets to lives to a ripe old age without having them done. But if you're happy with your vision, if it isn't broken, don't fix it.
If it isn't broken, don't fix it.
But if you're not able to live life to the full,
why not have it done?
Then you ought to fix it.
Yeah. Okay.
So, Theresa, Vision Bermuda, of course, is here to support people living with these conditions. And what do they need to do to get that extra support if they are, living with some vision loss? Because you talk about, your emphasis on the low vision clinic is huge for Vision Bermuda and finding options for those that have low vision that can't be corrected right now.
Yes. Yes, so please ring 292-3231 and you can self-refer.
Sure.
Or the doctor or anybody can refer you, but you can also just walk in to Vision Bermuda, have a look around, meet us.
Erica will be there, smiling.
Yes, she will. Yes, absolutely.
Teresa's out and about a lot more, but Erica is really just being the little engine that could there at Vision Bermuda right now. So as far as booking an eye exam, you don't need a referral, right, Dr. Jake? You can just do that yourself.
Give us a call on 543-1800, 543-1800.
Yeah.
And we'll book you in. It's as simple as that.
For sure. And if you happen to be, going past there, across from Masters, you could walk in and make your appointment too.
14 Dundon Street.
There you go.
West, yeah.
Yeah, I can't go wrong. So, holiday season's coming up, Theresa, and things like that. What about people learning to make still learning to make gingerbread and a turkey sandwich there at Vision Bermuda?
We've had a little break from cooking classes,
okay,
but we're going to be bringing it back again
for sure.
Very shortly.
It's about the time for that. There'll be some nice holiday baking going on, I'm sure. And I know for some of your clients that have been in here, it is the most enjoyable thing for them to come and take some of these social classes, we'll call them, that you guys are having there. And again, as far as, Vision Bermuda is concerned, they're here to support or whatever you need as far as your eyesight goes. And having
it's a lovely supportive community.
Sure. And so why not and for those who are taking care of folks with vision loss too, there's lots of support for caregivers as well, and ways for you to become involved. And for it to be, if there's... Volunteer, please. Yes. What's at the top of the wish list still for you guys?
Well, I would say drivers.
Still drivers.
Erica would say drivers, but I would say I'm desperate for somebody for IT still.
Still IT,
yes,
and
please.
certain software applications and such?
Yes.
Gotcha.
Yeah, somebody could give up their time to support clients with their iPhone or iPads and assistive technology, really.
Assistive technology, there's a lot out there.
The screen, anybody, that would just be amazing. Yeah, please.
Yeah.
But I say Erica would say about the volunteer drivers. Of course, I say that too, because our clients can't get to us easily.
Not as easily as they would like. Not everyone has a tribe around them to
or if somebody,
to
I'm just thinking outside the box.
Sure.
If you can't volunteer to drive, but you're able to donate towards taxis.
Sure.
Wow, that would be amazing as well.
Sure, because I know you have a few of your taxi drivers that are there for you. All the time, but of course they're a business that's trying to make a living too. They can only offer so much of a special package. But if you want to specify donations going for driving, that's something you can do. Is what you're saying?
Yes, please.
Yeah.
But anything, social media, anybody that has a passion and has some time to give, we will be able to fit you with the right.
For sure.
Job.
So any of those young creatives out there, as far as their technology and devices could have a little fun here, doing things like little advertising reels and so on, and fun stuff. But also, you'd be doing that thing where you're making a huge difference in someone else's life by helping them understand the supportive technologies that you're talking about. Awesome stuff. In case you've just joined us, we've had a lovely discussion with Dr. Jake from the Eye Health Clinic in here today on cataracts and glaucoma, and no one should be, suffering a vision loss because of those things. Now we have the best treatment available right here on the island, and you should seek it out. Our next Vision Talk will be the 11th of November, and we're glad you're joining us. And if anyone will benefit from this, we'll repeat this program on our sister station tomorrow at 5:15. So thanks for coming by, folks.
Thank you so much for coming in.
Thank you for having me. I hope I've been able to say something useful.
You certainly have, Dr. Jake. I'm sure you've made a difference to a lot of people who have been, just hearing too much of the brouhaha that is the avoidance of anything medical, and that we kind of suffer from. But do not despair. Help is there. That's the message we're putting out there.
That was nice. You rhymed.
I did. I have my moments. Thanks, guys, for coming by. Always looking forward to the next one. All right.
Thank you very much, Shelley.